Hi, my name is Dr. Rudra Mohan, and today through the Oral Health channel, today we're going to be talking about the connection between oral health and respiratory health. Let's start. So today's episode is actually very interesting, where I'm going to be talking about if there is any connection between your oral health and your respiratory health. So it's very important to know that the connection between the oral health and the respiratory health is actually very, very strong, because of the fact that when you're breathing in through your nose and your mouth, whatever is happening, there is a cavity known as the oropharynx, the nasopharynx, and then it becomes into this combined cavity, and then the air goes inside through your bronchioles and basically your to the alveoli of the lungs, and then the gaseous exchange happens. Now, because of the fact that there is an absolute connection, there is an anatomical connection between your lungs and your respiratory pathways with the mouth, there is a propensity of the bacteria of the mouth to go inside with the other constituents of the air that you're trying to breathe in, because of the continuity of the anatomy of the oral cavity with that of the lungs and the respiratory system. So in studies, it has been found that the microbiome, that is the microbiology or the microorganisms that are seen in the oral cavity of people, a lot of similarity is seen in the microbiology or the microorganisms or the microbiome seen in the lungs. Now, what could that connection be? It's very simple. There has not been a causal relationship between that. If you have bad oral health, you'll have bad respiratory health. But there have been studies to see that there is an association between the fact that people who are suffering from COPD, chronic obstructive pulmonary disease, emphysema, bronchiectasis, and pneumonia-like diseases, their oral health, when they have seen in hospitals and institutionalized patients, once they've taken the samples, the plaque samples from their teeth, it has been known that the people who are suffering from respiratory health issues, they have more compromised oral health. Now, we're not saying that oral health is actually causing problems in the the respiratory health. At the same time, you have to understand that why am I talking about this is because there have been studies that have been conducted where they found very particular pathogens that are found in periodontal disease or gum disease or dental caries, which are found in the lung parenchyma or in the lung biopsies or whatever that are taken, any samples that are taken in the form of sputum samples and all those things. The beauty about a lot of the respiratory system is that it has mucociliary clearance. That means basically whatever kind of pathological organisms you might be ingesting as a result of aspiration, you can expel them out because of the defense response of the mucociliary clearance. Now, we have seen studies where they have actually done intervention studies to compare groups who have had respiratory episodes of COPD, and they've noticed that intervention in terms of oral health, such as periodontal treatment, and they've come up with the conclusion that despite the fact that there is no causal association of oral health exacerbating respiratory health issues, but it has been found that we took care of the oral health of the patients with the help of treatment and intervention, their exacerbations and hospitalizations in the patients with respiratory issues were lesser in the people who were treated for their oral health compared to controls. So what I'm trying to say is that, see, at the end of the day, you have to understand that whatever is in your control, you can take care of it. So if you're a patient who's suffering from emphysema, first of all, make sure that you have left all your deleterious habits such as smoking and all those things. On top of that, you have to understand if you're a patient who's suffering from respiratory issues, and that is actually a very harrowing thing because you're not able to breathe, the most important vital function of your body, of your living sense. You have to understand, if not the respiratory health parameters or the environmental factors that might not be in your control, such as the pollution or the particulate matter, you can at least control your smoking, and you can at least take care of your oral health. So once you take care of your oral health, the respiratory load the inflammatory markers will go down. So what happens when you have bad oral health is very simple, that there is an inflammation which goes into a chronic state, and that releases chemical mediators such as C-reactive protein and interleukin 6. These chemical mediators cause chronic inflammation in the body, because of which you can get exacerbations of these respiratory issues. So you have to understand whatever is in your control, because of the fact that when you take care of your oral health and you take care of the inflammation in the oral cavity because of taking care of your gums and taking care of your oral health and hygiene and getting intervention in the form of dental caries restoration or periodontal treatment, you are kind of subduing or mitigating the amount of bacterial load or the inflammatory response of the body, thereby making sure that your body is actually in a better state to fight off infections and to fight off exacerbations of lung diseases. That's very important. And the second thing that I would like to talk about is people who are institutionalized or on the ventilator or mechanical ventilator on respiratory support. They're not getting adequate clearance and they are very much susceptible to community acquired pneumonia or nosocomial pneumonia. Now for those cases also, it is better that their oral hygiene, whenever they are basically able to, or in whatever way we can make sure that their oral hygiene is not compromised, it is better that we make sure that their oral hygiene and health is taken care of. That's very important because of the fact that they're not able to cleanse their area because of their mechanical ventilator support, and it all goes into the aspirate, all the aspirate goes inside the windpipe, and it can cause pneumonia and other things. So it's a very big and a very important concern when it comes to taking care of your oral health, so that you can take care of your systemic health such as your respiratory health. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Please refrain from calling me directly as I might be busy with patients. Just drop me a message with your name, your location, and the common oral health problem that's giving you discomfort. We can have a talk, and if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.